Good afternoon, everybody. My name is Scott McGann with the Falmouth Health Department. Today's March 4th, 2022, doing our COVID-19 update. I think the first time I did an update was in March of 2022, so we're getting on 2 years now. So our website is falmouthma.gov. This presentation will be put on that right on the top. health@falmouthma.gov is our website, and our phone number is 508-495-7485. So we have 4,067 PCR positive tests since the beginning of the pandemic, our first case being around March 19th of 2020. 15 confirmed cases for the week, 1 probable for the past week, not counting rapid home tests. That's off the radar. Those don't get reported. Our 14-day daily incidence rate dropped from 16.3 to 11.2. That time frame is between 2/13 and 2/26. That's how the state presents it. It's a little delay. The 2 full weeks prior to posting it yesterday, so you lose about 4 or 5 days from the posting. But that being said, it's definitely dropping, and it will continue to drop, and I'll talk about that in a sec. And our positivity is down to 4.20. And one of the reasons why, with a number of cases, why it's not lower is because there's a lot less PCR testing going on, so there's some less PCR testing because you're just dividing the number of positives into the number of tests. People have gone more to the home kit. Although, so that's sort of lagging probably a little higher than the number of cases indicate than what we were used to, because things are different now with the home tests. Number of weekly cases, you can see in the far right, you've got 3, we got 1, 2, 3, 4, 5, 6, 7, 8 or so weeks of which we've dropped down to numbers similar to right around the fall, November-ish. We had a couple of nice weeks around in that same time frame, or back in August, September, somewhere in that area is where we are at. So that's good. The flatter and more bunched up these dots are, the better. And you can see we're back into a nice pattern here after the Omicron surge that we had about a month and a half or so ago, where we had high case counts a couple months ago. Same thing happening in the county. Counties see the same drop off, so those 3-day average is in the 38 to 80 range or whatever in there. So that's similar to what you're seeing in Falmouth. You're seeing the rest of the Cape with case counts. The state last week I think was about 1,500. We're down to 1,000. There was one day this week we're actually under 1,000. I think it was Tuesday. And our positivity for the state on the 7-day average was 1.8. So that's definitely dropping. Deaths are a lagging indicator, so that still seems to be up. But that's could be a lagging indicator of what happened 5, 6, 7 weeks ago. And hospitalizations are definitely down. If you look at the trends, you see all of them really sort of bottoming out, which is what we were hoping for, and that's where we're at. Hospitalizations a little high in the last one. I was surprised to see 7. None in the ICU. Not quite sure what was going on. Usually that doesn't indicate. That's a little higher for the number of cases. We're not usually higher than Cape Cod Hospital, very rarely. It's a bigger hospital. But again, no ICU visits, but there were some extra hospitalizations, at least at this last one. We were 1 and 1 on the 23rd. So, one day doesn't make it, but we'll keep an eye on that, obviously, because I'll talk about hospitalizations later. As hospitalizations go, this is a state chart. Roughly, seems right around 45 to 55, right around between 42 and 50% of the time, the patients in the hospital are COVID as the primary reason. So slightly more than half are there incidentally. So the hospitals aren't being burdened. Best thing to say is with the levels that we're not in an area where the hospitals are being overburdened by COVID at this point. Our incidence rate, again, was 11.2. This number is working its way down as we start to collect later February. So the 27th and 8th and what's happened so far this week has been a lot better. That number will continue to dive down. And what I mean by that is if I scroll back up to this chart, we're catching those 2 weeks where we're right around that 30, 31. So these two I'm circling with the cursor. I hope you can see it. The far right, the second and the third to the last, that's the week that the incidence rate is. So if you start adding in what we had this past week, it's only going to work on its downward trend. So that's a good sign that our incidence rate's going down. Again, that would be 11 cases per 100,000. So you divide that by 3, roughly 4 or so cases, 3 to 4 cases per day is what the average was during that time frame. And we're looking somewhere in the middle of the road compared to our other towns on the Cape, sort of where we usually are, which is not bad considering, I guess it's better than being on the other end. Again, its positivity is 4.2. The state in that time frame was 2.32. The county's higher in positivity. I know testing has definitely gone down. A lot of testing is being ratcheted back. We're not getting a lot of people at the fairground testing at all, barely anybody. Home kits are sort of taking over, and plus less sickness. There's less people that feel that they've been exposed because it's less cases, so it makes sense. My favorite chart is this, what happens if you do get COVID once you've been fully vaccinated? There's been 450,688 breakthrough cases. 7,393 have been hospitalized, or only 1.64%. The death rate among that is 2,424 people out of 450,000 plus, is about 0.5%. That tells you that the vaccine's working, and also that Omicron was less severe than Delta, because these numbers are lower than they were during the Delta surge. Of all vaccinated people, 8.5% have had breakthrough cases, and of all vaccinated people, only 0.14% have been hospitalized since. So if you got COVID, well, hospitalization, if it had been vaxxed, hospitalization was 1.64. If you take the entire populations, because most people have not gotten a breakthrough, it's 0.14%. Vaccinations definitely tapered off. We were in a couple hundred, 200 to 300 over the last few weeks. We're 132 first, second, and third doses. Vaccination rates are what they are, so we've gained 21 first doses, 32 second doses, and 79 boosters, and that's kind of where we are. We're getting close to saturation. Everybody who's wanted a vaccine has had an easy chance. It's very simple to get them. You can get them today if you needed it. I just happened to be looking at VaxFinder, and it looked pretty easy to get a shot today if you chose to do so. So vaccine availability, VaxFinder pharmacies, Community MD, the Community Health Center, Barnstable County Health Office, Cape Cod Community College. They may be shying away. I just saw an email that they're going, at least some of the stop the spread. I believe the stop the spread at the Melody tents being eliminated. I just saw the email before I came up, just through lack of desire. Less cases again, and having the home kits is we're getting away from sort of the PCR, which makes using case counts as your major indicator a little tricky. And we'll talk about that in a second. And again, homebound, if you know somebody's homebound, has been looking for a vaccine for whatever reason, you call the health department, we'll set that person up with the VNA, and they'll come out and take care of that. Testing, pharmacies, Community MD, the hospital's still doing it, the Community Health Center in Mashpee, Cape Cod Church. Check the Barnstable County Health and Environment website, because they run the one at the church. They definitely have not had a lot of people come. It's down to like an hour a week because no one's coming. And again, of course, there's availability of home kits. Face coverings. Townwide mask advisory was back in May. Schools dropped the mask mandate after the school vacation, so this is the first week without a mask mandate in schools. Town buildings, the select board this past Monday removed the mask requirement on town-owned properties. Of course, masks definitely encouraged to help you, consider your health status and your situation and when you make your decisions, but it's not a requirement anywhere in town, except still for transportation. So transportation still has it. So if you fly or take a bus or things of that nature, that's still in place. So what are we doing now? So I used to do this chart every week and use this CDC metric. Now the state never adopted this. The state basically got rid of all guidance in the late spring of last year, and so we had to use something that was what's good, what's bad. We used this. The state never really, Dr. Katie Brown never really liked this particular metric, but we were using it. So I'm not going to use this anymore. That's why I put the red X, and we're going to use the new guidance. Now, I don't know how this is community level transmission. I don't know if the state's going to do anything with this. This is just from the CDC, not just, but the state usually makes it in a usable form for us. Maybe they'll start, doing something with it, heat map, something of that nature. I don't know. But it's taking into account hospitalizations and cases, not just cases, for a couple of reasons. First off, if Omicron was less hospitalizations, if the next variant that comes out is even less severe, it's not about the cases, it's about what the impact, on the hospitalizations and so forth. So, that's a lot of this mitigation was to stop the spread, to keep, hospitalizations minimized, and, the things that could go wrong with not having enough beds and so forth. So you're taking into account both of them. So fewer than 200 per 100,000 in the past 7 days, you can have a low, medium, or high based on your percentage of in-bed patients occupied by COVID-19 patients, okay, and COVID admissions. So you can be low, medium, high. Right now, Barnstable County is considered in the low. And according to the last time I looked, I haven't checked it today, but this chart I made on the Monday. And then if you have 200 or more cases per 100,000, then you can either be in the medium or high. All right, and again, so this is based on the COVID and how this is all going to mesh together. Whether the states are really going to go with this or not, I don't know. I just found this from the CDC. So I don't know exactly whether the state's going to kind of look at this and maybe do something with it and maybe refine it or something like that. But that's what we kind of have now, sort of looking at a combination. You know, I don't get great data for hospitalizations other than that chart that I provide you up top that I gave you before, which comes from Barnstable County. You know, I don't know whether we're going to sort of mesh it in, the state's going to mesh this together, or we're just going to kind of go by that number and kind of figure it out on our own. I'm not quite sure yet. But again, we're taking cases, so fewer than 200 cases per 100,000 over the past 7 days. So for Falmouth, you divide it by 3 because we have 33,000 people. So 3 into that's like 70, a little under 70 cases, between 65 and 70 so cases. So, you know, per week would be the fewer than 200. So you could follow in the low, medium category. And based on, so it takes basically the low category and places it into the medium category for hospitalizations when you have cases of 200 or more. And so that's kind of what they want you to look at now. And which I'm glad, you know, not using case counts. First off, if you don't get an accurate case count, you know, in 2021 you had a PCR or you had a rapid that from a Convenient MD or some of the places that do rapids, and that was your only way of knowing, and I would see them all. The health department would see them all. Contact tracers would see them all. Now the home kits, it's really hard to tell. So I guess we'll still stick with fewer than 200 known cases, and this is where the chart we'd use. And what does it mean? Well, personal preference on low. If you're immune compromised or at high risk, talk to your healthcare provider. So, you know, maybe consider wearing masks. If you have social contact, same thing. So if you have somebody you're taking care of, consider yourself for infection. Consider testing yourself. So basically it says if you live or have social contact with somebody at high risk for severe illness, consider testing yourself for infection before you get together and wearing a mask when indoors with them. That's when you're in medium risk. It's, again, not requirement. And high, it says wear masks indoor public, regardless of vaccination or individual risk, including school. So the CDC is saying if you get into the high category, you know, we are greater than the 10% of staffed inpatient beds or by COVID-19 patients, and you're having 200 or more cases, you know, that's when you would consider going into it. So I don't know if the DESE, who governs the schools, public schools, will adopt this or not. This is only a couple days old, and I haven't really heard anything either way, but this is right from the CDC, and it might be changed or not. This is just what I pulled off. So as a recap, case counts are at levels they're not seen since last summer, maybe in the fall too. We had a couple weeks of it. There's plenty of vaccine and testing capability right now. There are no mask mandates in town, but you want to consider, you know, what you're going to do personally based on your individual circumstances. So that's entirely up to you right now. You know, masks help to some extent, and you know, you take that into consideration when you do, you do your stuff. So that's it for this week. You know, hopefully you have another good week like we had this past week, and I plan on doing this again next Friday, and see everybody then. Thanks.